States related to restart. We received over that as well. We did not lose anybody to death in hospitals yesterday. That's good news. Although reporting off the state website related to nursing homes, it looks like at some point over the last 24 hours we lost 3 neighbors. Again, with this reporting, we don't know who and how, and we're under the presumption that it was COVID related. We don't know if they had COVID and something else happened or not, but certainly we lost 3 neighbors, so let's think about them and their families, and certainly keep them in our prayers. We've now lost 144 people in our county to COVID-19. Related to testing, we've now passed a good benchmark, 40,000 tests, 40,024 to be specific, have been administered. We're moving towards, in the next probably week and a half, we'll test 10% of our population in our county, which is a lot of testing. And so, again, really the community should be proud. Everybody's getting tested. A lot of folks wanting to get tested with no symptoms for various reasons. So I want to thank everybody. But a lot of tests. In the last 23 days alone, we have tested 22,379 individuals, and almost 1,000 per day. Certainly we have had holidays and lots going on in those days too, so very robust testing right now going on in our county. The community wants to be part of the solution. There are asymptomatic carriers who could potentially be spreading the virus, so this effort has helped certainly minimize that spread. When we began our testing before this all started, remember our infection rates between 8 and 8.5 for symptomatic testing with just strategic universal testing. Since May 11th, the infection rate has dropped to 5.6%. Our 7-day average is at 2% infection rate. Again, infection rate very low. 37,389 tests have been returned. 1,408 have been returned since yesterday. There are 2,182 positive tests in our county. That's 30 more since yesterday. And 36,615 have been negative results. We sent out 1,251 tests since yesterday. We have 1,227 pending tests. Again, 5.6% overall positive infection rate since the beginning of March, but 2% in our average. We are doing universal testing at the Syracuse Community Health Center site. Mobile testing, we've been hitting every different pocket of neighborhoods, going into neighborhoods where we think there could be some exposure to the virus, just getting in geographic parts of the community so that those communities nearby have an opportunity to get to a mobile testing site closer to home. We will continue to do that. Again, tomorrow we will have a testing site at the Immaculate Conception Church parking lot in Fayetteville in the town of Manlius. Again, I want to thank Legislator Holmquist for being such a strong advocate, pushing for this in his district. On Friday, June 5th, we have a testing site at PSLA, Public Service Leadership Academy at Fowler High School. So please, if you're in the neighborhood, please take advantage of these opportunities to get testing. Looking at our regional testing data, again, our partners in our other counties doing a great job. 775 is the goal. We had total tests yesterday, 2,413, triple the amount needed. In Onondaga County, we did over 1,200 tests alone. Certainly want to thank all of our partners in Madison and Oswego and Cortland and Cayuga County. They've picked up their testing. They have better data to make informed decisions. It matters what happens in the counties next to us. People live and work and shop and play in all of our regional counties, so we're a team. Daily average, 1,564 tests. When you look at the May 27th through June 2nd dates, double what's necessary. So we've done a very good job building up that infrastructure. Hospitalizations, we now have 74 people in the hospital, up 3 since yesterday. 42 individuals waiting discharge from the hospital to test COVID negative. We've put forward 2 plans to be transitional living areas so these folks can get out of the hospital and transition and wait to test negative, and then they can go to their homes. So we're waiting on the state for approval on that. I think we'll get there. 13 individuals are in critical. That's the same as yesterday. 45 of the folks in our hospitals are Caucasian, 13 African American, 6 of another race, 10 have declined to share their demographic information. To date, we have 258 people that have been released from our hospitals. When we look at our positive cases, again, up 30 on the day. Let's look at who they are. 6 of them are household contacts of previously confirmed cases. These are individuals that live in close quarters with COVID positive neighbors of ours, and we always knew that there would be a higher likelihood that you'd see higher transmission rates there. And so no surprise there. These folks are very little risk to the community because they've been in a quarantine. They haven't been out in the public. So we treat that category different because the risk to the community at large for the spread of infection is minimal. 18 of our new cases are affiliated with senior living facilities and nursing homes, up a little bit from where we've been, but still lower than where we were 3 weeks ago. So we'll be looking at and really studying this information to work with the state and help our partners in nursing homes. Certainly we know that these are the folks that have a higher likelihood to become a hospitalization, and then we know from there folks go to the ICU, and then they're in a real fight. So we need to continue to make progress there. We've made progress, but we need to watch that very closely. So 24 out of 30 there, 6 community spread. Our community spread is what we watch for the randomness of the infection, the risk to the public at large. Our 7-day average is below 10. Here we are, that's half of phase 1. Starting into phase 2, we can now say very comfortably phase 1 did not have an impact on raising the infection rate in this community. Actually, the numbers got better. The average for 7 days of community spread cases is 9 a day. I believe that's the lowest we've had since the first few weeks of this pandemic. So that's good information. We'll watch that. We'll compare that. We'll see what phase 2 really does. But right now, we're off to a good start. 13 new recoveries, 920 active cases, 1,123 people have recovered. Asymptomatic cases not related to nursing homes. This is a new stat. So out of our community spread and contacts, really our community spread numbers, because contacts they get symptoms. So out of our community spread numbers, 20% are asymptomatic. These are folks that are getting tested just because they wanted to. They weren't symptomatic, and 20% out of our new cases asymptomatic. Possible exposure, we'll go over this right now. We had an employee at the T-Mobile store on the corner of West Taft and Buckley Roads in Liverpool that has tested positive for COVID-19. Certainly we ask members of the public who visited the store on these days and times that they may have had exposure to this employee. Saturday, May 23rd, 10 a.m. to 8:30 p.m. Sunday, May 24th, 10 a.m. to 5:30 p.m. The employee was wearing a mask while working, but again, we want to, when there's a gap in the investigation, we want to let the public be aware so they can continue to monitor their own health, their own symptoms. Again, just because we're making progress with this virus doesn't mean we shouldn't be taking care of ourselves, checking our temperature on a daily basis, if not more rapidly than that in some cases. But again, May 23rd, 10 to 8:30, May 24th, 10 to 5:30, T-Mobile store, West Taft Road and Buckley Road. If you are there, please just watch your symptoms. You may have developed symptoms at this point. If you haven't, just continue to watch them. Call your doctor if you have questions. Number of cases. Out of our positive cases since March 16th, 1,298 have been female, 884 have been male, 104 under the age of 19, 359 in their 20s, 285 in their 30s, 268 in their 40s, 345 in their 50s, 277 in their 60s, 220 in their 70s, 198 in their 80s, and 126 in their 90s. Looking at where the cases are, first number is total cases, second number is recoveries. Syracuse, 1,233, 584 recoveries. Clay, 168, 113 recoveries. Onondaga, 135, 38 recoveries. Geddes, 111, 31 recoveries. Salina, 98, 59 recoveries. DeWitt, 80, 57 recoveries. Manlius, 77, 56 recoveries. Cicero, 70, 42 recoveries. Camilla, 67, 41 recoveries. Lysander, 37, with 30 recoveries. Pompey, 26 with 23 recoveries. Van Buren, 30 with 11 recoveries. Skaneateles, 15 and 15 recoveries. Lafayette, 8 with 4 recoveries. Marcellus, 8 with 6 recoveries. Elbridge, 5 with 2 recoveries. Otisco, 5 and 5 recoveries. Tully, 4 and 2 recoveries. Spafford, 3 and 2 recoveries. And Fabius, 2 cases and 2 recoveries. Looking at restart, we got very good news. We've been pushing very hard to have outdoor seating opened up at restaurants. We heard from the governor shortly, a short period of time ago, that has happened. Guidance will come out, but again, this gives our restaurants the ability to start to expand their service. It gives the public the ability to start to support local businesses in a new way. A big psyche win here, and certainly one that we've been pushing for. You heard it first here many weeks ago, so we're glad, and our partners are glad. Many of these restaurants are facing decisions whether to stay open or close. So we really need to support our local mom and pop shop restaurants now. Keep them going. Let's get them going. Keep them busy over the next few weeks here. Phase 3 restaurants will open up with indoor seating. So certainly we need to do that. Looking at, we've been talking about economics. I'll continue to talk about it. We received a sales tax payment today. Sobering data. The payment is off 37%. It's a large payment. That's $9 million less than it was the same time last year. Our year-to-date sales tax numbers at the end of Q1 were 4.6% growth. That would have been robust growth for our government and our revenue. It is now off 12% year-to-date. So the reality is, and we talked about this yesterday, the month of June, we need to rebalance everything, and we'll have very difficult decisions to make. And if we don't get help from the federal government, the decisions will be even worse. And if the state government cuts us, the decisions will be catastrophic. So certainly at the local level, we have some tough decisions to make. The legislature is going to be given with various options. They've been in a position where throughout this pandemic they've been very supportive, but now we have to balance things out. They're going to have different options. None of them are good, and we're going to need them to lead. So stay tuned for that. But again, we expect the sales tax payments to continue to go the wrong way in the month of June, which means we're going to have a shortfall, and we're going to have to cut our way out of it, and maybe with some small revenue enhancers. But there's no way around it, especially if there's no federal help and or if the state's going to cut us more. The options are not going to be good. Saying all that, let's take questions.
Are restaurants who have outdoor dining able to expand that outdoor dining, or? My
understanding is, I haven't seen the guidance yet, but my understanding is restaurants can open outdoors. So I don't know if the ability is there to expand or not. I can look at my executive powers to allow the local mayors to maybe avoid planning and zoning board reviews to get them open faster. Now that this is there from the state, I'll look at that. I have the ability to do that. And then the mayors in their communities or town supervisors can, if they want, they can make that decision. But that's how we would do that.
How does it feel to be one of the first voices for that movement and see it ultimately come to fruition?
It's good. It shows flexibility from the state. That's what we need now. The one-size-fits-all approach is challenging, especially when you look at we now know enough about phase one healthcare data to know that we didn't go backwards at all. We went forwards. Phase two is a new challenge. The community still needs to rally and understand we're going to be closer together. We need to continue to be very diligent. But we got, you know, we're into phase two. We'll be a week into this before we know it. So we'll start to see probably tomorrow and Friday any of the actions from Friday and Saturday popping up in phase two. And then certainly next week we'll know Monday, Tuesday, you know, you bring more density back in your downtowns. Do you see any spikes? So, but I think overall this is an important action. I'm happy the state made this move. I want to thank the governor for making this move. This gives us the ability to get more data too, from a public health standpoint, and you know, to figure out if this increases any risk for when restaurants fully open.
Ryan, when you talked about the sales tax numbers, does that include room occupancy tax revenues?
No, room occupancy tax is an absolute bust. So where that budget itself is, if we can get a third of what we budgeted for, that would be great. Those numbers will be off 60, 70, 80% year over year. And again, casino gaming numbers, Q2, absolute disaster. So the reality is we're getting ourselves through a pandemic, once in a 102 year event. There is no way around pain on this side of it, even if we get some help. The things we've been able to cut, and they're painful cuts. They're things we need to do when you're playing offense. And that's where we were with our poverty, infrastructure, and economic development strategy. We were on offense before this pandemic, and we've had to cut all that. So that's over $25–30 million of cuts that we've already made. Now you're looking at the revenue estimates we made for the shortfalls are now becoming a reality. It's not a surprise that these numbers are coming in where they are, but it's a reality. It's here now. So we've been talking about this for really 60 days. We've made decisions earlier, which gave us more time to where we are, but now we're out of time. There's no more. We have a half a year to make up what's going to be a massive, massive hole. And so the pain is going to be felt via cuts, via services, and potentially some short-term revenue enhancements to keep the absolute critical services, or else people are going to be really upset when they need a critical service and it's not there.
So when you say short-term revenue enhancements, what does that mean? Are you talking about?
Well, there's an energy,
taxes?
and we're one of the only counties in the whole state that doesn't have sales tax on energy purchases. We had that proposal there at the legislature. You know, quite frankly, the legislature didn't have the courage to vote on it yesterday. They wanted more information. Well, we've been telling them what the information is. We've been engaged this whole process. Well, here it is. So you'll have choices to make at their next meeting. They're going to have bad choices, but they were elected. They need to make a choice. You can't just punt because you don't like the decisions in a pandemic, and that's what some people were advocating for. So there's no punting in pandemics. If you're an elected official, you need to lead, and that's what we need out of them.
If you're fiscally even by the end of the year, if you balance the budget and coronavirus basically ends this year, can you bring back anyone who gets laid off? Mm-hmm. Can you return to the growth we were going to see if you truly balance this year?
Yeah, yeah. Look, our hope would be that we don't have to have any more personnel adjustments. That may not be realistic. I can guarantee you that's not realistic if the state of New York cuts us. That's a guarantee. But if the federal government doesn't help us, that's not realistic either. But there's still talk about a state bill, a local bill from the feds. State of New York needs help too. You can't deny that. My federal friends who act like the state of New York doesn't need help need to move on, and the reality is they need help. So the reality of this is we don't want to balance this on the back of our workforce, or else we're not going to be able to do the things we were doing. Now, it could be temporary, to your point. In 90, 120, 150 days, we may be calling everybody back, but what happens to those families over that period of time? So we're doing everything we can not to have to reorganize our entire county operation when it comes to our workforce, but when your costs are people and services, and you have what's going to probably be a $60 to $100 million revenue shortfall, 60 being good. Think about how bad that is. Think about, go find $60 million. No bake sales you do are going to get you there. So that would be good. We would have a fighting chance at that. But our costs have gone up because we've had to fight this virus in addition to that, and we didn't have those budgeted either. So it's a fiscal mess. We've prepared ourselves well to be in this point but we can't, the decisions have to be made in June at all levels. The state of New York is going to have to make decisions. The federal government's going to have to make a decision if they want to be helpful or not. And at the local level, we have to start making decisions. And unfortunately, these are not good decisions to make.
Raise now? Do you have to wait
Correct.
for a full budget cycle to do some
Yeah,
other?
there's no, our ability to raise revenue is very limited. We found that energy sales tax that for some reason we haven't been collecting for the last 30 years, that is the only one we found that we can even do by ourselves. So you're really just talking about cuts or the federal government coming in to help you. You can't, we'll exercise some of our rainy day fund, but we can't use all of it, or else our credit rating will drop down to junk bonds and we won't be able to borrow for projects. So there's certain things you just can't do because you got to live to fight another day, to your point.
Ryan, were there any, seemed to be a pretty quiet night last night, but anything happen outside of the city that you heard of significance? No,
I think, I think it was a quiet night. We've had, protesters each day. We've had protesters today, and certainly we expect some of these events to continue for the next few days. Overall, respectful. That's what, that's the best way to really honor Mr. Floyd and to really make a stand for positive change. And again, at the same time, our law enforcement professionals have been helping these protests happen peacefully and have been doing a very nice job with that. So, I think that's a balance, and so far between our protesters and our law enforcement community, they've found that balance in what are very stressful times.
Speaking of the protests, we heard that because of the protests that the treatment at the Justice Center has changed for some of the prisoners there, that maybe they're being denied showers and water and let out of their cells. How have they been treated throughout this whole thing?
Yeah, the sheriff would have to give you details. I can tell you when you have 1,000 or 2,000 people in the streets outside of the Justice Center, that building goes in a lockdown. Very dangerous situation. So that's one of the realities of that. There's nobody in or out, and that's for everybody's safety in that situation. But the sheriff can give you more details and specifics on what is or is not happening. But during a lockdown, it's a lockdown, and there's been a lot of protesting, so that may have triggered lockdowns.
I'm sorry if I missed this, but a few days ago you had said you were going to initiate testing at both Jamesville and the Justice Center. Have you gotten any of those tests back yet?
We've not been able to do testing at the Justice Center downtown because of the circumstances that we've been all dealing with. I'm not sure exactly where it is at Jamesville yet.
Looking at the coronavirus data, does anything stand out to you? Anything your health department's looking at out of the ordinary? Any demographic seeing an uptick?
No, we've seen a downtick in every demographic, including senior-related facilities. We had obviously more today, or the last 24-hour reporting period that we work off of, than the day before. But again, still a pretty decent number compared to where we were. But it's going in the right direction, whether that's because the virus is by itself weakening and moving to the southern hemisphere, or we're just doing a better job because we know more about it and we know how to protect ourselves and to be smart. It's probably a little bit of both, but we'll see. This is a big, if you don't see spikes in phase 2, you're probably not going to in phase 3. Because drastic density increases in phase 2 from phase 1.
How come the number of active cases is staying so high when the number of new cases every day is kind of in the 30 range? Is there a backlog at the health department?
Well, it's who the folks are, right? So you're looking at when 65 or 70% of your cases are related to nursing homes and senior facilities, that's a minimum of a 14-day recovery period. That doesn't mean it's 14 days. That's a minimum. And then when the rules have changed again related to how long you're in a isolation period if you're under 65. So that's what it is. I think when you look at the new cases and you look at the recoveries, the recoveries and actives are now pretty much on par. It's going to take a while to weed itself out.
As the county uncovers more of these asymptomatic cases, is there the ability to circle back to see if they were truly asymptomatic, or perhaps they were just pre-symptomatic? They may have developed symptoms a few days later.
Good question. I'll check on that with Dr. Gupta. It's a very good question. Maybe we caught him right in the beginning. Yeah, we'll look at that.
Do you know how many businesses opened in phase 2?
I think overall we're over, for the attestations, I think we're over 1,100 countywide right now. And I think yesterday we had about 80 or 90 alone, and get those numbers specifically for tomorrow. But yeah, there's folks, new businesses attesting. There's some that probably should have attested that have been open the whole time that haven't. But each day there's more and more that attest, and then we get that information so that we have it in the event of a complaint, so when we go to the facility, if they're supposed to be operating or not. So, so that's, we can have that specific number though tomorrow.
That's 1,100 in phase 1 and phase 2?
Correct.
Not just since Friday?
Correct.
Is there a timeline on, will phase 2 still be 14 days, or is there kind of flexibility in that?
Well, I think it's, I think, let me laugh this one off. I think what we're doing here, I think we're taking 2 weeks of data, and then there's going to be some review from some of the state's advisors within that next 24-hour period. So I think we're looking at either a 14 or 15-day restart going into phase 3.
Why
so
is
it might
that
be
so
might be
funny?
14, it might be 15. We'll see. I just felt like laughing, Trish. That's all.
What did you talk about today with the regional group? Did you set any short-term goals, some new goals, and any decisions?
Yeah, we learned about the decision from the state on restaurants, so that was good news. It's good to get that kind of news when you start those calls. Lightens the mood a little bit. But certainly one of the things we're looking for, we put forward a plan related to religious institutions. We desperately need that plan approved. There is a lot going on in the community, and folks need to be able to go to church, go to their synagogue, go to their mosque with everything they've been going through. And you can do it in a safe way. And if we couldn't do it in a safe way, I wouldn't be advocating for it. So everybody's agreed, 25%, phase 2, good number. So we're very serious about this, that this needs to happen. And there's conflicting guidance as well. The federal government, which I believe some people in the community are probably just taking the federal government guidance, which is just you're open, and then the state guidance, and then there's people in between. So why don't we just give people one set of guidance that's specific to our community that we believe is in the best for the mental health and the ability to get back to church and the ability for our public health officials to be comfortable with the numbers. So that's what our proposal is. We need action. We really do, Terry. So
That
hopefully
sense
we'll
of
see that.
urgency, is that connected to the protests?
Absolutely, absolutely. And you have what's going on in the country with the pandemic situation around what happened in Minneapolis, and it's impacting everybody differently. And a lot of our ways we communicate in our community is through our clergy, and there are leaders within the community, and not just in the city, but in the suburbs as well. And so there's just too much going on to look at our health data and say beaches are open, you can go to Walmart and hang out with 250 of your closest friends, but you got to have 10 people in a church or a synagogue or a mosque. It's just too much going on. It's just we got to move forward. We got to move forward, and we got to give guidance, because none of these religious leaders want to be sideways with anybody. They don't want me upset at them. They don't want the governor upset. They don't want the president upset. So let's just give clarity to this so that they can do the right thing, because they want their parishioners to be healthy as well. Other questions? Well, I want to certainly good news, outdoor seating, restaurants, big time good news. Let's help these businesses out. And please, I know everybody's been doing a great job with takeout. This is a big day for these businesses. It's going to help get some people back to work. So the good news of the day is, was it phase 2.5 with this move here? This is a big move. The governor made phase 2.5 with this move today. So we want to thank the governor for that, and let's support our businesses. Thank you.